Hello and welcome to our second episode on health, where we talk about one nation, 100% health. Today we delve into the world of self-care, exploring its importance, impact and intersection with technology. We'll also look at how nutrition is a critical aspect of self-care and how it can serve as a foundation for broader wellness practices. In fact, research shows that self-care has a profound impact on a country's overall health and productivity. By prioritizing self-care, individuals can reduce stress, boost resilience, and improve their quality of life. So how can we make self-care more accessible and achievable? That's where technology comes in, from digital wellness platforms to AI-powered self-care tools. Innovation is empowering people to take control of their well-being. Joining us today, we have with us Dr. Sunila Garg, Chair Program Advisory Committee, National Institute of Health and Family Welfare, ex-head Sub-Dean, Maulana Azad Medical College, New Delhi; Caroline Melado, Head Sustainability, Integration and Inclusive Growth, Bayer Consumer Health; Sandeep Verma, Country Head, India, Bangladesh and Sri Lanka, Bayer Consumer Health. We also have with us Ishi Khosla, Clinical Nutritionist, Author, Columnist, Founder, Celiac Society of India. And joining us on Zoom is Pooja Malhotra, Fitness Expert and Nutritionist. Thank you all so much for joining us on this very critical conversation today. To begin with, Sunila ji, I would like to ask you, what role does self-care play in the continuum of healthcare, and how can it reduce the burden on healthcare system? Because there's also been a study that, if you take care of your health, you do not need to keep visiting the doctors, you don't need to go to healthcare facilities.
How important is self-care? Self-care does not only comprise of, diet and exercises and all that. It comprises of, taking care of holistic care of your body. That part is very, very important. So that means you are taking care of your diet in terms of balanced diet, in care of your exercises, whatever you take, that part has to be spent in. So that part is important. And another thing is, for everything, you don't start taking antibiotics. For little symptoms, you don't work on that, because India is also on the top of antimicrobial resistance.
Yes.
So that part becomes very, very important. So self-care is, I'll say, holistic care, which is taking complete care of yourself. And also I like to say that we are facing a huge burden of non-communicable diseases, and out of which India is a diabetic capital of the world. And these are all because of lack of, partly I'll say that majority of the times it is because of lack of self-care. So that part becomes very important. If we are able to take self-care with regard to our body, so we'll be able to take care of all these problems, whether we talk of undernutrition, overnutrition, whether we talk of huge burden of obesity, and taking care from healthcare providers and unnecessarily avoiding of, antimicrobials which are not required.
Okay, so very critical points. Ishi, how would you define, holistic self-care? For you, what does that really mean? And what steps can individuals like us, what can we do, to ensure that we're taking good care of our health? And another question which I would like to add on here for you is good nutrition the foundation of self-care? There is a connect, if you can explain that.
Taken the words out of my mouth. It is the foundation.
Okay.
And having said that, we must understand that our health is really not only our physical body, but our mental health, our emotional state, and the spiritual being. We have all these four parts of us which are important to manage holistic health. And out of this, if you look at your food and nutrition, if you eat well and you practice, you have some good healthy practices, which means exercising regularly, doing some yoga, meditation, whatever works for you, and you work on a diet which is focused on the gut, the diet which is focusing on your digestion, you are surely on the right path to managing your self-care. And self-care also, like I said, physical body inside out. So, when you have how you're looking and your hair and your body inside, everything put together matters. And I think the foundation is certainly nutrition and food. I would not, when I say nutrition, it's micro. When I say food and diet, it's much bigger.
Yeah, so that's an important aspect.
Yeah.
So I think what you said, it's interesting when you say what you eat and what is within really shows outside. I think that's also a very interesting point you've made. Yeah. Caroline, if you can, just tell us, how is Bayer working, to advance self-care? And I know again the connect between self-care and good nutrition.
Absolutely. No, thanks for having this conversation that is so important. I can start with the super macro level with the impact of self-care on health system. There is some research that was done by the Global Self-Care Federation that found that self-care, as it is, helps alleviate the burden on healthcare systems.
Yes.
It helps save as much as $119 billion per year. This is massive. This is really about saving time from the health systems, from the physicians, as well as the individuals themselves, to make sure that they get their health needs covered while not burdening the health systems. This also means that it opens up time and resources to address other
diseases, yeah.
significantly more severe diseases. That also plays at an individual level. We know that self-care helps basically everybody go to work every day, right? This is really about how you can prevent illnesses, you can avoid missing a day at work. And through the same study, we found that self-care helps individuals help save between 11 to 12 productive days per year per person. It's pretty significant. And if you translate that into the income that those productive days mean, in South Asia, we're talking about $48 per person per year that you can save or still earn and not miss out on because you have taken good care of yourself.
Yeah, yeah.
That's something that we've really identified as Bayer, especially in the context of the global population with 50% that does not have access to basic health services. So truly, self-care is the only option.
Yes.
So it is critical to try and help advance it.
Yeah.
We are committed to really helping billions of people live healthier lives with the most trusted self-care brands. I mentioned that because the trust is around science.
Yes.
Science-based self-care is what will help everyone in the comprehensive way of taking care of oneself really touch on the key medical needs.
Yeah.
And we're doing this through engagement with partnerships, through R&D and innovation, as well as really advocating and having important conversations like today about the role of self-care in achieving universal healthcare for all.
Yeah, absolutely. I think really well put. Sandeep, if I can come to you as a country, do you see India or do you see the opportunity for self-care in our country? Because we're at least talking about it. Very often women don't get time. We've all heard about, on the flight, put on the oxygen mask yourself before you make your child wear it. But do you really see that in India? Is great adoption policy possible here?
And I think there is a huge adoption potential of self-care in India. And I will give you 4 or 5 points, but though there are many, but I'll give you 4 or 5 points. The biggest factor which can help us in terms of adopting self-care in India is our demographics. We are a nation of young people. Okay, we have the median age of this country is 28 or 29, which means that we have a bunch of people who are technically savvy, who are technologically savvy, who are not burdened by their past, who are willing to take chances, who are willing to take care of themselves if they are provided the right tools. So this demographic balance gives us a huge advantage as compared to any other nation in the world. So that's one. The second thing, the digital penetration, the internet penetration in India is absolutely humongous. You have internet penetration in tier 2, tier 3 cities, even in the rural areas, though in the rural areas it can be more. But we still have almost 800 million smartphones in this country at the last count, which means that there is a chance of providing information, raising awareness to so many people across this nation. So internet penetration is the second one. The third one is the fact that there is a rise in disposable income amongst at least the middle income families in India, which means that people have more money to spend on the self-care solution. Now, everybody knows that self-care should not be expensive, it should be accessible. But at least there is that propensity to spend because of the disposable income that you have. The fourth factor is the rise of D2C brands and e-commerce in India. There are so many D2C brands, okay, and the fact that there is now an e-commerce platform available to them that are targeting specific deficiencies, specific problems, health problems, nutrition, pain, etc., which are addressing your specific needs. So if you know what exactly you are seeking, you'll get the answer for there. And I think the last point, which I think to my mind is a 50-50, is the rise of social media in this country. Now, some of it is good, some of it is
Huge debate
bad.
on that, yeah.
It's a huge debate. But there are some good healthcare influencers on social media, which if you can identify, you should definitely follow them. So I think these 5 factors give the rise of a huge adoption potential in this country of self-care.
Isha, I just want to come to you. So in our country, again, when we look at, diverse regions, certain places, the traditional diets where the staples are more, rice is more, they don't have enough of vegetables, or you're not eating the right kind of intake, and again, the colorful plate. What would you recommend to ensure individuals get 100% nutritional intake? Because that does have a clear connect with self-care. How should one know what to eat so that you stay healthy? That's an important aspect as well.
Yeah. So,
And I want to add on to that so that you can, club it together. Also, the way we cook our foods, what is the right way? Should you be boiling it? Again, we have so much of diversity in the way we cook as well.
yes, absolutely. So I think let's just define what are our goals when you
Yes.
talk about self-care. So I think as a nation we have this double burden of overweight and obesity and undernutrition and micronutrient malnutrition. So it's a very large burden that we are suffering from, and considering that we are seeing overweight and obesity even among the lower income groups, which is very disturbing. So essentially what we should really aim is to get our weight and our waist measurements in control. So that's a very important tip for everybody who's trying to do self-care, that stand on the scale every day. Don't become 100, you don't become 100 kgs in one
Overnight.
year. It's a gradual process. So what the red flag is when you are tipping over. And whether it's a BMI or you do your waist measurements, you have to track it. A large waist and a small, the BMI being okay also doesn't work. And we have this huge problem of central obesity, which is again linked to diseases. So these are very simple things. Stand on the scale every day, measure your waist every day. And if you're bloated, if you have issues, despite the fact that you're doing everything right, go and get expert advice and work on your gut. So these are very easy to do things for anybody. It doesn't cost very much. Then of course to investigate, to assess, you can manage what you measure. So get your tests done, and today we know the burden of micronutrient malnutrition is huge, whether it's vitamin D, whether it's B12, whether it's iron deficiency, and I'm seeing all of those severe, critically low levels among the obese, among those who are eating animal food almost 3 times a day. So there are big myths here that, oh, I have vitamin B12 deficiency, I am a vegetarian. No, it's not about being vegetarian, it's about your gut health. So essentially assess your levels and then supplement accordingly under professional advice. The other very captive and important cohort of people in our population is the pregnant women. I think because they are really bearing the burden of the future generation, the health burden. And today we know that according to public health experts that this generation of kids is not going to outlive its parents, something which has never happened in the evolution of mankind, which is serious. So I think pregnant women, before they become pregnant, should prepare and do a lot of self-care. And
to ensure that the next generation is healthy. I think that's a very
healthy.
critical point.
Yes, yes.
So, Pooja, if I could just come to you here, we're talking about self-care and why it's important and how relevant it is. And obviously, self-care without fitness, and as a fitness expert, if you can give us some tips. I mean, there's a clear link between physical fitness and how it impacts your mental health as well. Tell us a little bit about that, and why is it important to, give that 1 hour to yourself every day to ensure that you're fit?
Yeah. Hi, thank you for having me over. Self-care is extremely important. Self-care, I would say, is the highest form of self-respect. It begins with, taking care of ourselves at the physical level, the mental level, the emotional level, because, be it any individual, you cannot, do justice to what you are doing if you are not healthy. And good nutrition is the pinnacle of self-care. So when we are taking charge of our own health, when we are actively, taking care of our own health, then it's highly likely that we can detect problems before they start. we can pick up problems with our health before they start. Nutrition is extremely important because what we put in our mouth has a direct impact on our physical well-being. It affects our mood, our energy levels, our stamina, our immunity, how we can deal with all the stresses, the physical stresses, with diseases, how it impacts us in the short term as well as in the long run. So eating a nutritious diet, it forms the mainstay of healthcare. But besides that, of course, being physically active, getting a good amount of sleep. Nowadays our devices also will alert us about how much sleep we are getting, the hydration levels, eating on time. So all these things, getting our regular health checkups done, so that we are aware of our nutritional status, our health state, all the biomarkers, and we can be alerted well in time if there are some problems which are developing.
Yeah, so taking care of our health, it gives us, that signal. So on that note, we're going to be taking a really short break. Do stay tuned because we'll be having this conversation on self-care after this break. Welcome back. Caroline, I would like to ask you, just before the break, Pooja mentioned about, how sometimes our phones and, digital equipment can help as well. What role do you see of using these digital tools for self-care?
We heard earlier from Sandeep as well about the deep phone penetration, for example, in India and across the world. The technology is where it's never been before. And this is a huge hope and opportunity to accelerate our ability to empower everyone to make decisions about their own health and put that in their own hands. Yes. What we were talking about also earlier is that we need to be mindful about the type of information we get. What is really interesting with technology is that we can have tools that leverage, say, AI, for example, or other ways of detecting issues that can also help individuals make decisions, whether it is about to go and see an actual healthcare professional or adapt their lifestyle, diets, and other steps on their daily basis. What's also incredibly important with digital is that it can help bridge the gap to accessing basic health services. We were talking about the gap that exists for 50% of the world, isn't it? So if physically individuals cannot get to a healthcare provider, then digital tools can help bring the healthcare provider's advice and services into their homes.
Yeah. Sandeep, I'm going to ask you here, because you're leading a team, and of course Caroline spoke about about digital tools as well. Bayer does use tech in a big way. Your thoughts on that? How are y'all Bayer leveraging technology when it comes to self-care and nutrition?
Yeah, so let me just divide the question into two parts. How have we used technology for consumers, and also how have we used technology for healthcare workers? Because we've also been, doing a lot of work with the healthcare workers. So, and on the consumer front, let me just give you a very specific example. I mean, we're all very clear that technology can really change the shape of self-care. So let me give you a specific example of things that we have done. We basically created this app called, for a brand Saradon called Arampur, where the idea was that people who have a lot of headaches, giving them some kind of information on why would they be having headache, and also giving them some solution on how to get rid of the headache, which may not necessarily be to take the pill. It can also be some financial advice, because we figured that one of the big reasons for headache was stress caused by financial issues or stress caused by many other things. So we developed this app called Saradon Arampur, which was a voice-based AI, which could be used on any dumb phone itself. So that was the first thing we did, and we did this in Aligarh. Again, we did it in semi-urban UP and parts of UP, and we are now expanding it into other parts. The second big example I would give you is the way we use social media, and I spoke about that earlier as well. We very recently launched a new product under our core brand Saradon called Saradon Woman. It is basically period pain medication. It's a medication which reduces period pain for women. And instead of doing a conventional launch, we actually did a Q&A session on social media with gynecologists. And because one of the big challenges we figured was the myths that surround this whole area of periods and period pain, etc. So we got a gynecologist and we made her accessible to thousands of people on the internet. Also, women found that whole area a little bit safer to ask the questions directly to the gynecologist. So we did that launch in that manner. And last point on the healthcare workers part. So we work with this organization called Reach 52, which is a social enterprise. And there we've developed an app for the healthcare workers. So the job of the healthcare worker is basically to go door to door to collect data from that household, what does their nutrition need, what are they doing currently, and what answers can be provided. And then they have to go back to that household again after giving them the information to check whether they have acted on it or not. So we've created an app which works offline for the healthcare worker, which trains the healthcare worker on how they need to do it, how they need to collect their data and everything else. So that works very, very seamlessly and very easy. And it's in the local language. So we plan to take that across to many other states.
So reaching out to them and also ensuring it's working. Pooja, if I can come to you, since we are talking about digital tools and we're talking about apps, how do you envision AI-powered personalized self-care recommendations influencing consumer behavior and self-care habits? And what potential benefits or drawbacks do you see in this emerging trend?
See, there is so much technology available now. There are innumerous wearable devices. The smartphones that we have been using for so many years have been providing us information about our sleep, about our activity level. There are wearable devices which help us to monitor our blood pressure, body temperature, even oxygen saturation level, blood sugar levels, the heart rate. There are so many times we hear news where some smart devices have helped save lives of people by alerting them to, irregular heartbeat patterns, which can be detected by these wearable devices. So these devices can be used very smartly. Of course, they cannot replace a human professional advice, but they can be a great tool to assist in terms of detection, in terms of collecting your data and analyzing the data. Of course, the recommendations can be provided by the apps. They can be AI powered, but they cannot replace a human professional, because a human professional would add an element of understanding the cultural preferences,
absolutely,
being sensitive, being empathetic. Now, that is not what AI can do, but AI can greatly support.
Yeah, I think those are really valid points. When using the tool, thanks Pooja, I think using the tools, knowing it, but also being sure what you're actually doing. Well, besides a public-private partnership, emerging technologies hold tremendous potential for democratizing access to self-care and nutrition. We must remember that self-care is more than just a luxury. It is a necessity for maintaining our physical, emotional and mental health. Thank you so much for watching.